good to go.
Okay, great, thanks. So Dalton, Carlos, first things first, thanks for making time for me today. Please keep this conversational, and any questions or comments you have throughout, I'm happy, please interject whenever. So my name is Shannon, and I am the Vice President of Operations for Chartjoy. I am a registered nurse by training. My background is in emergency room medicine, and then I also have my MBA from the University of Virginia. And I'm part of the founding team for Chartjoy. And so Chartjoy is a new medical scribe company. And we are doing this as a joint venture with the Medical University of South Carolina, or MUSC for short. And so MUSC and Chartjoy are partnering together to create this company. We plan to, work throughout different areas of the country, but right now very focused on MUSC as our business partner, as well as our first client that we are deploying scribes out to. And so with this initiative, we are setting up scribe programs in both the inpatient settings like the emergency room or hospital medicine, as well as in outpatient settings, which is like their OB-GYN clinics or their pediatric ortho clinics that they have. And so not only is this taking place in their main campus in Charleston, but this is also happening in their regional network. So in other areas of South Carolina, specifically Marion, South Carolina, Florence, Lancaster, and Chester. And so what I've been doing, a big part of my job for operations, is helping to set up these scribe programs, but then also recruiting for the scribes that can fill this position. And so, ideally, we can jump into this later, but looking for graduating students who are interested in a pre-health or pre-med, or pre-health or pre-med, and are interested in a career in healthcare, are looking for an opportunity to get clinical exposure, as well as to develop their resume and their candidacy for med school or for PA school or what have you. Are detail-oriented, are fun to work with, and are just really excited to be working in healthcare and alongside physicians and nurse practitioners and PAs. So that's Chartjoy in a nutshell. I'm happy to dive into that more and about how we're implementing throughout MUSC. But let me tell you a little more about medical scribing. So medical scribing is medical scribes take over the administrative burden that is placed on physicians and providers. I think there's data out there that says that 45% of a ER physician's time is spent charting. So you can imagine that's almost half a day of a shift where a clinician in the ER is spent merely charting. And so when you think through the ER and their waiting room and how severely sick many of their patients are, you can imagine what it would mean for them if all of a sudden they can dedicate a large portion of their time to that care instead of charting. And so what a medical scribe is responsible for is documenting every aspect of the care a patient receives. So a medical scribe will work alongside a physician. They will go to see patients alongside the physician. So they walk in the room, they listen to the encounter. That encounter, a physician finds out, why did this patient come in today to see me? What is this patient experiencing with their symptoms? What is this patient's past medical history? And then doctors will usually do an exam on this patient too. And then eventually they go on to order labs or x-rays, or will order consults on this patient. All of that is documented in an electronic medical record in a very systematic and formulaic way. And as what we do as Chartjoy is we train scribes up on how to chart in that specific manner, how to use the electronic medical record. And we also teach them tips and tricks for, medical abbreviation, medical terminology. What are some common diseases and illnesses you will come across in your specific setting? And then we'll have scribe leaders to help you learn the trade. And after about a 3-week training process, you'll be off and charting on your own. So it's a really exciting job. Again, this is because you're working alongside a physician, and because you're getting so much exposure to healthcare in that job. Medical scribing is truly for those who are interested in healthcare. And perhaps you're interested in healthcare, but you're just not sure what path you want to take. This is a really good option. Perhaps you decide after 6 months, like, I don't want anything to do with healthcare, because this is, and that's okay too. Or maybe you fall in love with a part of medicine that you never thought you would like, and now you want to go to med school to become a specialist in that specialty. All of those are possibilities. And what I would say is that, if you're looking for an opportunity to utilize your gap year, whether that's 1 or 2 years, this is a great way to grow professionally, while also preparing for this next chapter, while also living in a beautiful place like Charleston and having fun outside of work. So that's my gist. What questions do you have, if any?
I have a couple. Carlos, do you want to go first?
Oh, you can go first.
Okay. So Shannon, you mentioned that you train the students on sort of like medical scribing, the jargon, etc. And you said, I think it was about 3 weeks. So
Yep.
you also mentioned, like, say 6 months in, you don't like healthcare, you can leave, that kind of thing, obviously. But my curiosity then is, like, say you do 6 months in the ER and you're interested in switching into something else. Is it like rotationally based, or how does that work?
Great question. Thanks, Dalton. So when you start with Chartjoy, you will be assigned to a specific unit. So maybe it's the emergency room, or maybe it's the pediatric orthopedic clinic. That will vary depending on when you are available to start and where that coincides with our deployment timeline, if that makes sense. And so, yeah, perhaps you're in the pediatric clinics, you get to know the role really well. You get to know pediatric orthopedic really well, the physicians. After 6 months in, this may not be the right fit for you. Rather, it's, you hate kids, so you hate seeing them every single day, right? Totally fine, no judgment there. That's when our management and our leadership comes into handy. So you will have a scribe manager that you are constantly checking in with on a regular cadence. And these are the types of things that we're assessing for and that we're asking you about. And I think in addition to, like, is this the right fit or not for me? It's also like, what are your goals? What are some of the things that you're hoping to hone in on? Because knowing that you might become a rock star, and we want to hone in on that. And maybe that's you become the next scribe trainer, or you become the head scribe that's helping to lead other scribes. Or maybe we're sending you into a new setting to help us set up that program. All of those possibilities exist. And what I would say is, as much as you're willing to put into it, we're able to get out of it we're able to put into it for you as well. And I would say the longer you stay with us, the more possibilities and more doors open too. And so, yeah, and I also know that someone just joined, and I wanted to say hello. My name's Shannon. Thanks for coming. Hi, this is super conversational, so feel free to jump in with any questions, and happy to chat with you afterwards too.
Thank you.
So quick follow-up to that, because you mentioned that they would be reporting to a scribe manager. What does that, I guess I'm asking, what does that kind of look like in terms of, are they meeting with them once a week, once every 2 weeks, once a month?
Yeah, so
With this being newer.
yeah, so in the first 3 months you're starting, the first 90 days, you go through the 3-week training process, and then afterwards, yes, there's several aspects. We are doing quality assurance to make sure that your charts are up to par, and then also doing any course correction that's needed. So perhaps this is Shannon really needs to work on her medical abbreviations and her medical terminology. We're going to spend some extra time going over that, and watch her over the next, this 90-day probationary period, we call it. But yeah, throughout it, we'll have regular cadences. It's probably going to be once a week from the get-go. And then as you become more comfortable, it will drop down to every 2 weeks. But you will be seeing your manager on a daily or weekly basis, just in clinic. And it's just a matter of finding that time to do one-on-one check-ins. And so, yeah, what in the ER, I'll pick on the ER right now. We have, let's call it 12 scribes that are staffing the emergency room. These 12 scribes will be led by a head scribe who will help with the scheduling, will help with any conflicts that can emerge, or if you're unsure of what specific policies are, or if you want some clarification on a case you saw, this would be your main go-to person to help you through that, right? And when I say that there's opportunities to grow, like those head scribes once were new scribes too, and they were general scribes, and they worked themselves up, they worked their way up. And so those opportunities exist too if you were wanting to do a 2-year gap year, or 1.5-year gap year, you would have the ability to do that.
I had a quick question. So you said you're assigned to a unit, for instance, like a specialty or the ER. In there, do you stick to one physician or provider, or do you branch out to different providers within that unit?
Yeah, great question. So what I would say is that best case scenario, you are working for one department and you're working with one physician, right? But I would say that for some settings, that's not always realistic. So the emergency room is a really great example where there is a pool of physicians assigned and dedicated to the ER, but they're doing shift work. And so there's more flexibility with the types of shift you can work. So it may be, I've worked with these 5 different physicians, and I don't always work with each one every day, but I have worked with them in the past, and I'm familiar with them. Whereas if you're assigned to a clinic-based setting where it's 9 to 5, Monday through Friday, let's call it, maybe I'm working with Dr. Kin on Monday, Wednesdays, and Fridays because he's in surgery on Tuesdays and Thursdays. But on Tuesdays and Thursdays, I'm working with Dr. Carlos, right? But every Monday through Friday, I'm working that same schedule. Does that make sense? Okay.
Yes, thank you.
Yeah.
About how many students are you looking to hire?
So we are, great question. So I will say that we're looking right now about 50 students. We have hired a lot so far, but we still are looking for about 15 more, I would say. That we have openings in Charleston, as well as in the 4 other locations within South Carolina, which are Florence, Marion, Chester, and Lancaster. Gotcha. I will also say that we are growing rapidly, both within MUSC as well as with we've already started talking to other health systems and groups within South Carolina and beyond. So it's likely that in the next year and in the next 6 months, we'll have a lot more opportunities opening up. So maybe it's not the right fit for you now, or maybe you're holding off on getting off wait lists or what have you. We will likely have an opening that fits your needs here in the next few months.
Okay, perfect.
Yeah.
Can you talk a little bit more about the relationship with MUSC? I'm curious as to how that got started.
Yeah, so MUSC, There's a group within MUSC who knew, the three founders of Chartjoy, there's three of them. There's Sam Jones, Scott Parks, and Dr. Brian Clare. They actually used to own and operate a Scribe company in the past. About 5 or 6 years ago, they had grown it really quickly, and it was bought by Scribe America. And Scribe America, if you're not familiar, is right now, they're a huge Scribe company. They have they're all over the nation, and they also have an international presence. So these three business partners have a lot of industry experience. And so MUSC simultaneous, so MUSC in the last year has decided that they wanted to take Scribe and Scribe programs in-house, that they wanted to help manage it. They wanted to deploy scribes in every aspect of their health system. But they also knew that these three business partners had a lot of Scribe experience and were in the Charleston area. And so then butted a relationship of a joint venture. And it was just like, hey, we're really interested in funding this. You have a lot of experience doing this. What if we created a partnership, and then we'll be your first client that you're deploying scribes to? And so so that's where we are right now. I will say that with this, we have very close ties to MUSC. If you are interested in going to one of their grad schools, this is a really great way to not only get to know a lot of the physicians and other clinicians that are involved with their various grad schools. But also I think that this is really great exposure to the Chartjoy leadership team, who has very close connections within MUSC. And then, so I hope that answers your question, Dalton.
It did. I was kind of like angling towards, would that help students get into MUSC if they wanted to? And it does. So that's good to know, because they're
yeah. So I wouldn't say that we have this like special relationship with the med school or what have you. But what I would say is that we have very close connections to all of these different programs, and that this is, MUSC is aware that Chartjoy is hiring these scribes that are eventually interested in going into these different programs. And so it's just a really great way to gain visibility.
For sure. Thank you.
Mm-hmm. Yeah. And, that kind of brings me on, like, not only is this a really great pathway into MUSC, but we are offering some other benefits too. One of them is a discounted Kaplan Mcat course. And this will be for employees that stay with us for 6 months. After they hit that 6 month mark, we'll give them access to a free Kaplan course. And then if they want to do one of the Kaplan Deluxe courses, you'll get it at a discounted rate if you're interested. Also, Dr. Brian Clare, who's one of the founders, and he's also our chief medical officer. He has years and years of experience using medical scribes. He's an ER physician by training. And he's a board member of the Trinity School of Medicine down in the Caribbean. And so very close ties to this med school. And I think that after a scribe sticks with us for about a year or so, we're arranging it so that you have a guaranteed interview with this med school if you're interested in pursuing that route. So different benefits, we're trying to also link up with apartment complexes within Charleston to get you discounted housing. Not a lot of luck yet, but we're working on it. And beyond just these cool things we're doing, I think we're also very focused on the community we're building. I mean, we're asking close to 50 people to move to Charleston. Many of them have never been to Charleston before. And so we want to make sure that when you move here, you're coming into a really warm and welcoming environment, and that you feel a sense of camaraderie when you see other Chartjoy scribes. And then also outside of work, which is also really important time, because that's when you're working on your other goals and you're, rebooting and rejuvenating, that you feel like you have a community to step into and enjoy that time off with. And so we're doing a lot to help build that. Right now we have a group meet going of all the accepted scribes. We have a Facebook group. We're introducing scribes to one another, looking for roommates. All of that is happening right now and will continue to grow as Chartjoy continues to grow.
Awesome. Thank you for sharing that. Do y'all have any additional questions for Shannon?
I have a final question for the application process. How does it look like, and is there a different process, or does it look differently if you're pursuing like 1 or 2 gap years?
Great question. No, the application does not look different depending on what your commitment level is, which is A-okay. So what I will do is in the chat, I will send our link to our application website. And we are basing our applications by location that you're interested in applying to. So you'll see like Medical Scribe, Charleston, Medical Scribe, Chester, South Carolina, what have it. And so I'm going to put that link in the chat. From there, we review applications and then we reach out to applicants. And then we'll do 2 rounds of interviews. The first round will be with me, just to get to know you and why you wanted to apply to the position, tell you a little more about Chartjoy and the training process. And then the second phase of the interview, or the second interview, is with one of our head scribes. And this is someone who will likely become one of your managers or will be managing your manager. And they'll talk you through what scribing has been like for them, both with Chartjoy and with other companies. They'll talk you through, what's it like to be scribing on your own in a trauma, or what's it like, having, working with all these physicians on a day-to-day basis, and how has that impacted your med school applications? I mean, all of those questions you'll be able to get answered for you. And then after that, we deliberate and we'll make decisions and extend offers. So I would say it's a rolling admissions in the sense that we are constantly reviewing applications, interviewing, and then hiring, while also simultaneously assessing what our needs are and figuring out where we're able to hire scribes and where we're not.
What would you say makes an applicant stand out?
Yeah, so I would say that applicants, professionalism is very important because they are working alongside physicians. And so not only are you representing Chartjoy when you're working with that doctor, but when you're in front of patients and when you're working with other staff like nurses and technicians. So that's important to us. Very strong communication skills. So a scribe is listening to a patient encounter and 2 people talking, and they have to quickly be able to digest that information and then translate it and transcribe it into the electronic medical record. So that you have to be really quick you have to be quick to type. You have to be able to hear information and be able to jot it down very quickly, and then also be confident and comfortable clarifying information as needed, right? So it's like, hey, doc, did you want me to chart this or did you want me to chart that? Being able to have those sort of conversations and feel comfortable doing so. I think thirdly, also looking for scribes who are really interested in learning and having fun and are going to show up every day with a good attitude and realize that no one is perfect, not their scribes they're working with or their manager or myself. So are like, hey, this is weird, or we need to fix this, but I'm going to help you fix it. Those go-getter attitudes we really appreciate and are drawn to. Other than that, I think it's, this first group of scribes we're hiring are going to be so important going forward, because they are, they're starting a path that people are going to be using for the next several years with MUSC. And so we're looking for leaders who are really open to a new opportunity and are, just fun outside of work, like to hang out with others, that type of thing.
Awesome. Thank you. I know we are running out of time here. Do y'all have any last minute questions before we let Shannon go? Awesome. Well, thank you so much for joining us. We really appreciate it.
Yeah, well, thank you for your time. I appreciate it. And in the chat, I put the application, the link to our application, as well as my email address. And you can reach out to me personally, or if you know of any friends who would be interested, they're welcome to reach out too.
Thank you. Thank you. All right.
Thank you.
It.
Thank you.
Bye.